the nares,
Nasal septum.
nasal septum, which can't be shown on a mid-sagittal model. Probably, you'd have to use a skull to point at the nasal septum, okay? And you can easily see, look on one of those skulls over there, and see it. Not shown here, because it would cover up what's, inside the nasal cavity.
Superior, middle, and inferior nasal conchae.
Okay, so we're familiar with the conchae, superior, middle, and inferior.
And then the superior, middle, and inferior meatus.
Okay, the meatuses are the spaces, superior, middle, and inferior meatus.
Nasopharynx.
The nasopharynx begins at the posterior aspect of the conchae, okay? And so this orifice right here, going down to the bottom of the uvula there, is the nasopharynx.
Oropharynx.
The oropharynx is in between the uvula and the epiglottis. It is synonymous, it's our throat, isn't it? Okay.
Laryngopharynx.
Laryngopharynx is in between the epiglottis and the bottom of the airway there.
And then we have the frontal, maxillary, sphenoid, ethmoid
Okay.
sinuses.
The only ones that can be seen on our models are the frontal sinus and the sphenoid sinus. Okay.
Okay, then larynx.
Okay. The larynx is beautifully shown on this model. Okay. So we see the hyoid bone up here, which is the upper margin of the larynx. It's this entire structure.
Thyroid cartilage.
Okay. The largest of the cartilages is the thyroid cartilage. Okay.
Cricoid cartilage.
Cricoid cartilage just inferior to that.
Epiglottis.
Okay. And you can see the epiglottis. If we turn it around there, that's this little flap that closes over the glottis, which is underneath it. And there's some duplication. You can also see those structures. You can see the slice through the epiglottis on this one, which if I had another hand, I guess I could point to it with my forefinger. There's epiglottis. Okay.
Vocal
Yeah, turn
cords.
it this way a little bit.
A better view of the vocal cords, but I've got to show it to everybody. Okay.
The arytenoid cartilage.
The arytenoid cartilage, better shown on this one. These little cartilages right here that are kind of on hinges, and they attach to the vocal cord, and if muscles, and there are muscles attached to them, if the muscles pull back on them, it stretches the vocal cords and puts more tension on them, and your voice is then at a higher pitch. Okay.
Tracheal rings.
Tracheal C rings, you can see nicely on this.
Right and left bronchi.
Right and left main stem bronchi.
Carina.
Carina is the bifurcation.
Lobar bronchi.
Okay, the lobar bronchi. So there's one. There's one. There's one. There's one.
Segmental bronchi.
And the little colored ones are segmental bronchi.
Bronchioles.
Too small to show on here, yeah.
And then pleural membranes.
Okay, the pleural membranes really show up pretty well. You can see the membrane lining, the inner lining of the thoracic cavity there, showing up pretty nicely. So, and you can see where it comes down there,
gray, the gray
They're
one?
grayish, yes.
Superior, inferior, and middle lobes of the right lung,
Yep, there they are.
and then superior, inferior lobes of the left lung.
Yep. And you can see it, left lung only has two.
Costophrenic angle,
Costophrenic angle shows up nicely, it's way down here.
cardiophrenic angle,
Okay, the cardiophrenic angle, kinda gotta use your imagination a little bit. Sorry for those folks over there, but, maybe I can turn this a little bit. I don't wanna bonk that into you. Okay.
mediastinum,
Mediastinum, space in between the lungs. Full of a lot of stuff, isn't it? Okay.
cardiac notch,
Cardiac notch, you can see why the left lung is so much smaller. It's got this notch that's occupied by the heart. Okay, it's why this lung only has two lobes. Okay.
the external and internal intercostal muscles,
Okay, so we kind of had to reach for this one. But you can see them right here. They're shown the best. The superficial, you see two layers of muscle in between these ribs. Okay? The superficial layer has the grain going in one direction. Okay? And the deep layer, so that would be the external intercostals. The deep layer has grains that are going the opposite direction. So you can see why when they contract, opposite things happen. Okay? So,
diaphragm,
diaphragm, shown nicely here.
and then the crus of the
The
diaphragm.
crus of the diaphragm shown nicely here. You can see this rather elaborate attachment. Okay? And the crus of the diaphragm kind of fuses into the psoas major muscles down inferiorly down here.
Okay, now we're going to the urinary system.
Urinary system. So-
Adrenal gland,
So, you've all seen from cadaver pictures and everything that the adrenal gland really doesn't look like that. They show it always sitting right on top of the kidney. It's really thin for one thing. It's almost razor thin, and it's generally off to one side a little bit. Okay, so
renal artery and vein,
renal artery and vein.
renal hilus,
The renal hilus is this region where all the tubes go in and out.
renal cortex,
Renal cortex is out here.
renal medulla,
The renal medulla is deeper.
renal pyramids,
The renal pyramid, there's sort of the tissue is divided into these segments, these units, okay, that are roughly pyramidal.
Can you point it
Okay.
this way?
What?
Can you show it this way? Okay, thank you.
Okay, so you can see a number of these renal pyramids, and each renal pyramid, and of course they're out in 3 dimensions, aren't they? The renal pyramids, each renal pyramid drains into a minor calyx. So you can see there.
renal papillae,
And right at the tip of each renal pyramid is a renal papilla. Papilla is the Latin word for nipple. And urine drips off the renal papilla into the minor calyx.
interlobar arteries,
Okay? The interlobar arteries are these large ones in between the pyramids. Okay?
arcuate arteries,
The arcuate artery goes around like that.
interlobar arteries,
The interlobular arteries are out here.
and then interlobular veins,
And the corresponding veins, okay, interlobar, arcuate, and interlobular.
nephron,
The nephron, they actually endeavor to show a nephron on here. And so those little yellow things, you could either call them a Bowman's capsule or a renal corpuscle, either one. But if I point to that, which I could actually ask you some parts of a nephron
Yeah.
here.
Yes.
Yeah, it's doable. And coming right off of the renal corpuscle, this first little part is the proximal convoluted tubule. Then you would have the descending limb of the loop of Henle. And coming back up the other side is the ascending limb of the loop of Henle. And then up here would be the distal convoluted tubule. And then it turns the corner and comes back down finally as the collecting tubule. And a whole bunch of nephrons actually drain into that collecting tubule. And the very tip of it is the papillary duct. So you'd all have to come up and eyeball it if I asked one of those little parts, but I probably will.
Glomerular capillary.
Okay, the glomerular capillary, that's not doable off here.
Okay. The glomerulus.
Glomerulus is, let's not do the word glomerulus. Okay. I like renal corpuscle better than glomerulus.
Afferent.
And the afferent and afferent arteriole are all good, but I could only ask them off a picture, and I might do that. And the efferent arteriole evolves into the peritubular capillary, doesn't it? Okay, that then wraps all around the nephron, which we'll be talking about a lot on Monday.
So the minor calyx.
Okay, so we have the drainage system, the minor calyx,
The major calyx.
okay, and several minor calyces drain into a major calyx, and the several major calyces confluence into this renal pelvis here, and the renal pelvis narrows into the ureter. Okay,
Urinary bladder.
and so then we follow the ureters down, okay, and they merge with the urinary bladder. And we have both a male and a female part that plug into here. It's quite elaborate. Okay, and so you can see, here's the ureter right there, how the ureter comes down and enters the bladder right there. Okay, and that's the so-called ureterocystic junction. Is that a lab word on this
Yes,
list?
it is. It's the next
Yeah,
one.
yeah. So that's one of my favorites.
Yes.
I love the way that rolls off the tongue.
Urethra.
Okay, the urethra on the male is quite elaborate. So if I take this in half, the part that goes through the prostate gland is the prostatic urethra. Okay, and then here we see a representation of the urogenital diaphragm, the muscular floor of the pelvic cavity. So the part that goes through that is called the membranous urethra. Then this is the corpus spongiosum of the penis, and the part that goes through that is called the spongy urethra.
That's it.
Is that all?
That's
That's
all.
Okay. Piece of cake.